Hi there. Thank you for joining us and welcome to our Medicare 101 virtual seminar. If you are looking for a simple and easy to understand educational video on what you need to know about Medicare, you came to the right place. Sit back and enjoy. Medicare 180 is a local independent insurance agency that specializes in Medicare insurance and many other ancillary insurance needs. At Medicare 180, client education is our focus. Being informed is the best way to make a decision. The topics we will cover in this informational seminar will include Original Medicare Parts A and B, Prescription Drug Plans or Part D, Medicare Supplement Plans also known as Medigap, and Medicare Advantage or Part C. Part A, or hospital insurance, typically refers to the costs associated with the facility and room and board, where Part B medical insurance helps cover the medical services provided while in confinement. Part D prescription drug coverage helps cover the cost of prescription medications. We will dive deeper into the ins and outs of prescription drug plans in this presentation. When it comes to your options for adding additional coverages to the basics that Original Medicare offers, there will be two routes to go. The first option is retaining your Original Medicare and adding a standalone prescription drug plan and a Medicare supplement or Medigap policy. We will further discuss this option in the presentation. Your second option for adding coverages and benefits behind what's provided by Original Medicare would be a Medicare Advantage plan. These plans typically include your Parts A, B, and a Part D prescription drug plan. We will further discuss this option in this presentation. Original Medicare is provided by the federal government and includes Parts A and B. Original Medicare is accepted by any hospital or doctor in the country that accepts Medicare. Most people will not have to pay a Part A premium. If you or your spouse paid Federal Insurance Contributions Act tax for 10 years or 40 quarters, your Part A premium is paid for. Most will have to pay a Part B premium, though. Generally, you will have to pay a portion of each Medicare service provided via deductibles, coinsurance, and copayments. There is no maximum out-of-pocket cost on Original Medicare, and there is no coverage for dental, vision, or hearing on Original Medicare. Because of these gaps and lacking coverages, we will further discuss the Medicare Supplement and Advantage plan options. The Part B premium and deductible amounts are adjusted annually by the Centers for Medicare and Medicaid Services. The Part B premium rate for 2020 is $144.60 or higher depending on income. Your Part B premium will be automatically deducted from your benefit check if you receive benefits from Social Security or Railroad Retirement Board. If you do not receive these benefits, you will get a bill for Part B premium. Your Part B deductible rate for 2020 is $198. After your deductible is met, you typically pay 20% of the Medicare approved amount for most doctor services. Now, you could have to pay a late enrollment penalty if you don't sign up when first eligible. Your Part B premium amount is income-based. This chart breaks down the 2020 premium numbers depending on whether you filed individual or joint income tax. It is important to know that these values are based on your income tax from 2 years prior, meaning they will be using your tax information from 2018 to determine your 2020 Part B premium. This is your new red, white, and blue Medicare card. You will notice this card displays your name, individualized Medicare number, and your Part A and B effective dates. There are multiple ways to enroll in Original Medicare. Typically, the most convenient way is online enrollment through the Social Security website. The URL is www.ssa.gov/benefits/Medicare. This can also be accomplished by phone or by visiting your local Social Security Administration office. There are multiple enrollment opportunities to get enrolled into Original Medicare. We will go over a few of the common ones here. Automatic enrollment will occur for anyone currently collecting Social Security retirement benefits, Railroad Retirement Board benefits, or Social Security disability benefits for 24 months. In this scenario, your Medicare card should arrive about 3 months prior to your effective dates. Keep in mind, Social Security disability beneficiaries will have individualized effective dates based on their award date. Another common enrollment opportunity is for folks who want their Medicare effective dates to begin at the beginning of their eligibility, or their 65th birth month. The initial enrollment period, or IEP, is a 7-month window around your 65th birth month. If you wait until the month you turn 65 or 3 months after, your Part B coverage will be delayed. This may cause a gap in coverage. You must utilize the first 3 months of your initial enrollment period to avoid any coverage delays. You can enroll in Original Medicare anytime during this 7-month window to avoid a late enrollment penalty, but you will see your coverage start dates will change depending on when you enroll during these 7 months. A more and more common enrollment opportunity is for those who delayed their Part B enrollment due to a continuation of credible group coverage, as more folks are working past 65 and or their spouse still carries a credible insurance. In this instance, you will want to plan for your Medicare start dates in correlation to the end of your group or employer coverage to avoid any penalties or delays. Part D prescription drug plans are offered to anyone with Medicare. They are offered by privatized insurance companies and approved by Medicare. Prescription drug plans can also carry a late enrollment penalty, just like Part B if not properly planned for. Whether you have current prescription medications that you need financial assistance in paying for or not, you will need to hold a Part D plan to avoid penalties. The Part D penalty is 1% of the average monthly prescription drug premium multiplied by the number of months that you did not have a plan. It's important to remember that prescription drug plans can be reviewed and changed during the annual enrollment period each year. The two different ways to get prescription drug coverage are through standalone prescription drug plans that you would add to Original Medicare with your Medigap, or through Medicare Advantage plans that include prescription drug coverage. Each and every Part D prescription drug plan follows the CMS annually adjusted coverage phases. These phases will determine the cost share for your prescription fills throughout the calendar year. This is a very important part of choosing the right Medicare policy that fits your individual needs. The prescription drug plans can make the difference in thousands of dollars a year for some. There are 4 coverage phases in a calendar year. The first is the deductible phase. Once your deductible has been met, you will move into the initial coverage phase, where you will pay a set copay amount based on the plan's drug formulary. Once you and your plan have spent a combined $4,020, you will move into the coverage gap or donut hole. In this stage, you'll pay a 25% coinsurance for both generic and brand name meds. If you spend more than $6,350 in total out-of-pocket costs in combined stages 1, 2, and 3, you'll move out of the donut hole and into the last stage. The final stage is the catastrophic phase. In this stage, you will pay a copay of $3.60 for generics, $8.95 for brand names, or a 5% coinsurance depending on whichever is more. You will stay in the catastrophic phase until the end of the year and begin back in phase 1 on January 1st of the following year. A drug formulary is the list of medications that are covered by the specific plan. Many plans have a tiered formulary that divides drugs into groups called tiers. Tiers 1 and 2 are typically your lower cost medications, where tier 3, 4, and 5 can be much more costly. A specific medication may be listed as a Tier 4 with Carrier A and a Tier 2 with Carrier B. Again, this can be the difference of thousands of dollars a year for some. Alright, let's dive a little further into the two options we said you will have to add some additional coverages and benefits to your original Medicare. We will first take a look at adding a standalone prescription drug plan and a Medigap policy to supplement and fill in the gaps of original Medicare. Medicare supplements or Medigap plans offer additional coverage that fills gaps in original Medicare. Medigap is provided by privatized insurance companies. You must pay a premium in addition to Part B. Premiums vary by region, policy, and company. Plan options are standardized, meaning cost is one of the main differences between two companies that offer the same Medicare supplement plan. Plans have minimum standards that each carrier must uphold, meaning a Plan G is a Plan G and a Plan N is a Plan N. While premium cost is one of the main factors in deciding between Medigap plan carriers, other factors include the reputation and history of the insurance carrier, the size of the risk pool associated with your premium rate increases every year, and also the customer service and care provided by the insurance carrier. We will now take a closer look at two of the most popular Medigap policies available to the newly Medicare eligible. These would be Plans G and N. Plan G will offer the most comprehensive coverage to newly eligible Medicare enrollees beginning in 2020. Plan G covers 100% of Medicare approved expenses, including the Part B excess charges, but does not cover the Part B deductible. Plan N will cover 100% of approved services, but you may still need to pay a copay for office and ER visits. Plan N will not cover excess charges or Part B deductible. Excess charges refer to the up to 15% that providers can charge above and beyond the amount that Medicare will cover per service. Enrolling in a Medigap plan in the state of Michigan requires an understanding of guaranteed issue. During your Medigap open enrollment period, you will have a 6-month window to join any Medigap plan with any carrier you choose with no medical underwriting. You are considered to have a guarantee issue right. Other than some qualifying factors, outside of your 6-month open enrollment period, you can apply for Medicare supplement policies at any time by going through medical underwriting. There is no guarantee of acceptance during this time, and insurance companies set their own medical underwriting requirements. We will now take a look at another Medicare insurance option that is quickly gaining popularity, especially in Michigan. Medicare Advantage plans are most similar to the group and employer plans you are likely used to, in the sense that they are network-based plans, such as an HMO or PPO. Medicare Advantage plans combine both Part A, B, and most times Part D prescription drug coverage. Medicare Advantage plans must cover all services that original Medicare covers. Medicare Advantage is still a part of the Medicare program, but is provided by privatized insurance companies and approved by Medicare. In addition to your Part B premium, there might be a monthly premium for Medicare Advantage plans, although there are many $0 plans available. Here you will see a small list of popular benefits often offered in Medicare Advantage plans. These benefits and extras are plan-specific and vary from carrier to carrier. Plan benefits and extras include dental, vision, and hearing coverage, preventative and routine care, over-the-counter benefit, fitness and wellness memberships, routine chiropractic care, out-of-state travel benefits, and even virtual and in-home visits. Medicare Advantage network types will determine your freedom and flexibility when it comes to accessing providers and also determine your cost share amounts. HMO plans typically require you to see a primary care physician as a gatekeeper to gain access to new specialists, but also carry lower copays and maximum out of pocket amounts. Whereas PPO plans allow you to see in and out of network doctors, typically not needing a referral to see a specialist, but may carry higher copay and maximum out of pocket costs. The dual eligible special needs plans are a very strong plan available to those who qualify. You must be eligible for both Medicaid and Medicare. Let's take a final look at the differences between Medicare Supplement and Advantage plans. There are no network restrictions in Medigap plans, allowing you to gain access to any provider in the U.S. that accepts Medicare, whereas in an Advantage plan, you will need to follow the network rules set by the carrier. Medigap policies allow year-round enrollment, but depending on eligibility, you may or may not have to pass through medical underwriting to be accepted. Advantage plans do not have underwritten requirements, but there are certain periods throughout the year in which a person may elect an Advantage plan. You will pay a monthly premium for your Medigap policy, but may have little to no out-of-pocket costs. Medicare Advantage plans may come as low as $0 a month, but will have set copay amounts for provided services. Lastly, Part D prescription drug plans need to be added to a Medigap policy in the form of a standalone drug plan that carries a monthly premium, whereas most Medicare Advantage plans have Part D coverage built in at no additional premium. Let's compare independent and captive agents. Independent agents are authorized to offer many different Medicare plans and are contracted directly with Medicare insurance carriers and report to the Centers for Medicare and Medicaid Services. Independent agents are not financially incentivized to sell a particular product. We have a large portfolio of Medicare plans allowing us to fit your plan to your unique needs. You do not pay Medicare insurance agents. Independent agents are paid by the carrier for writing business with them. Our services are cost-free. Captive agents, on the other hand, only represent one carrier. They will only be able to offer you a few plan options whether they fit your needs or not. Captive agents can also receive bonuses for selling specific plans and meeting quotas. Whether it is one of our own licensed independent agents at Medicare 180 or another local agency, we always advise seeking the advice of an independent agent. Just a couple of important reminders before we let you go. The initial enrollment period, again, is a 7-month window around your 65th birth month. You must sign up for A and B in the first 3 months prior to your 65th birth month for an effective date of the first day of your 65th birth month. The annual enrollment period every year from October 15th to December 7th will allow current Medicare Advantage and prescription drug plan clients to make a plan switch if need be. The next step is to have an individualized conversation with a licensed agent to plan for enrollment periods and quote plans. I want to thank you very much for your time today. I hope you enjoyed our presentation and learned something new about Medicare. We look forward to taking the next step with you, your friends, or family members that need assistance in preparing for their upcoming enrollment into Medicare, or just need help having their current Medicare plan reviewed for maximum cost savings. Have a wonderful day, and remember, being informed is the best way to make a decision.